All right, welcome everybody. My name is Michelle Campbell. You'll see my picture there on the screen, of course. And today we're going to go over Medicare 101, which is the basics of Medicare, what it costs, how and when to enroll, and what plan options that you have. So with that, let's go ahead and get started. By the way, I should tell you I'm an independent agent and I've been doing Medicare for 15 years. I've been in insurance over 30 years. So hopefully I'll be able to fill in all the blanks of your questions today. We'll take questions at the very end. Okay, so first of all, original Medicare is Part A and B only. I know you hear about A, B, C, D, but only Part A and B is original Medicare. A is your inpatient side, Part B is your outpatient side. As you see here, they call it kind of hospital Part A, but it's really inpatient in the hospital because if you go to the emergency room, that's covered under Part B, okay, and that's at the hospital. So they call that medical side. You have this unique 11-digit number, and that's what you'll be given once you apply for Medicare, and that's a number we're always waiting to get to enroll people into additional health plans. So we'll talk about how and when to enroll here in a minute. So as your inpatient coverage under Part A, that covers inpatient hospital stays, skilled nursing facility, hospice care, and some home health care. Your outpatient side is kind of everything else. It's your doctor visits, outpatient surgeries, all kinds of diagnostic testing and lab work, medical equipment. That can be anything from a CPAP machine to diabetic supplies to a wheelchair. Preventative services is like your annual physical and different testing like bone density, mammograms, PSA screening tests, stuff like that. And emergency services is like urgent care and emergency room, ambulance. Okay. A lot of people ask me how is it different basically than like your employer group coverage or individual coverage? It's not. It's the same coverage. Everything medically necessary is covered on all of our insurance in America, basically. It's just what do I pay for that coverage? So that's that's dependent on what health plan you go with. So Um, so you're eligible at age 65 or under 65 if you have certain qualifying disabilities such as end-stage renal disease or ALS or Lou Gehrig's disease. You have to be a citizen or legal resident, and you must live in the U.S. for 5 consecutive years prior to applying for Medicare. Oh, sorry, I went too fast. Okay, so the cost for Part A is free if you worked your 40 quarters, which equates to 10 years. If you don't get it free, if you did not work 40 quarters, then you pay based on the amount of quarters that you have worked. So you could pay either 278 or 506. I think that'll be going up for 2024, so it might be a little more next year. The standard rate is 164.90. That is going up to 174.70 next year. It always goes up usually a little bit each year. IRMAA is an increase in both Part B and D, which is the drug plan, if you're a high income earner. So you'll get notified of this IRMAA adjustment, and they're looking back 2 years at your adjusted gross income. So let's look at the next screen. That's what I was going to. The next screen here is the IRMAA adjustment for the Part B premiums. So as you see here, if you're single and you make $97,000 or less, or if you're married filing a joint return making $194,000 or less, you're going to pay $164.90. Okay, but and if you're married filing a separate return, then of course it's $97,000 or less. But if you make a higher amount, there's all these different brackets. So if you make $300,000 and you're married, you're going to pay $428.60, and this is a monthly amount for Part B. If you remember, A and B is just the government side, and that's you would be paying Social Security every month for Part B. Okay, this information is available on Medicare.gov, so feel free to go there and you can see the 2024 amounts. And then Part D, which is the drug plan, they also add an IRMAA to your drug plan premium. So let's say you have a drug plan premium, it's $20 a month. So, and you're in the standard rate. So you're just paying whatever that plan premium is. And there's premiums that run from literally 40 cents. Yes, 40 cents for next year to $122 or even a little higher than that. I think 160 is the highest premium. Most people are paying less than that. They're usually paying 50 to 40 cents. So if you had a $20 premium, they would add, and you're in this bracket, they would add that $12.20 to your plan premium. Okay. And again, it's a 2-year look back. So to enroll in Social Security, you go, or I'm sorry, Medicare, you go to Social Security or SSA.gov. You will be automatically enrolled into Medicare A and B if you're collecting Social Security already. Okay. If you're on Social Security disability, after 24 months, they'll enroll you automatically. You can delay Part B if you are still working and you don't want to take out Medicare yet. You don't want to take out Part B if you're still working because you're just wasting your money. It does not coordinate with your group plan. So you can delay Part B without a penalty. But if you work for a company less than 20 employees, you must sign up for Part B. And if you're on an HSA plan, you cannot take out Parts A and B. So an HSA plan is where you have a high deductible health plan with a health savings account where you're putting money in that's tax deferred. Medicare is considered a high deductible health plan, so you can't even sign up for Part A. However, if you work for a company that's less than 20 employees and you have an HSA, you do have to sign up for Medicare A and B. So always check with Social Security to double check anything I'm telling you, but this is how it is. So when you first turn 65, typically that's going to be your initial enrollment period. It could be for someone that's eligible under 65. You're still going to have the 7-month window. Basically, you get Medicare on your birthday month. If your birthday is anywhere from the 2nd to the end of the month, let's say it's January 2nd through the end of the month, you're going to be eligible January 1st. So you can enroll October, November, December for a January 1st effective date. If you're born on the 1st of the month, you're going to get an extra month. So you would be effective December 1st. And then you can enroll also up to 3 months after your birthday, and that's that 7-month window. After that, you would start incurring a penalty if you didn't have creditable coverage in place, which would be like, a group plan or TRICARE or something. Okay, Part B penalties. You have 8 months to enroll in Part B before you get a penalty. If you do get a penalty, it's 10% for every 12-month period that you could have had B, but you did not take it. If you qualify for Medi-Cal or Part D extra help, they will waive the penalty. COBRA is not considered creditable coverage for Part B. It is for the drug plan, but not for Part B. So again, we have different penalties on Part D. You have 3 months after your Medicare initial enrollment period, which you saw that 7-month window. After that 3 months after your birthday time frame, you will start incurring a penalty. Unless you have an employer group plan, you're fine. So let's say now let's say you're older, you're past 65, and you now are retiring. You have 2 months after leaving that group plan or union plan to get your drug coverage. And so after that 60 days, you will start incurring a penalty unless you've taken out COBRA, because COBRA is creditable. Not for B, but only for the drug plan, for the Part D. I don't know why you would want to take out COBRA. It's going to be more expensive, but I always say check in with me and I can explain it, on your individual basis. Okay, so we are in the annual enrollment period right now, October 15th to December 7th. This is where people can switch their Medicare coverage. Basically, a lot of people are either switching their Medicare Advantage plans, picking up a drug plan, changing drug plans. Supplements don't really have an open enrollment window, so people going into a supplement at this time of year have to qualify. So they have different rules. This annual enrollment is really about Medicare Advantage and drug plans. Then we have a Medicare Advantage. Oh, I'm sorry. Back on this open annual enrollment period, everything we change during this time frame is effective January 1st. Then the first quarter of the year, we have this Medicare Advantage open enrollment period where if you're on a Medicare Advantage plan, you can you can make one choice, one plan change during this time, and you can move to another Advantage plan, or you can go back to original Medicare and pick up a drug plan and apply for a supplement, which doesn't mean you're guaranteed you're going to get it. If you have medical issues, you could be declined. So again, we always say, talk to us. We'll help you figure out whether you would be approved or not. It's pretty cut and dry. Then we have special enrollments, which happen all year. And this is really our most common one is people retiring, and which means you're going to lose your group coverage. So people retire all times of the year. You can move, or if you're moving out of the plan service area. So Medicare Advantage plans are based in the county that you live in. So here we're in Santa Clara County here. If you move to Monterey County, you're going to lose that Advantage plan. So now you have a special enrollment to purchase new plans down there. If you receive assistance from the state in the form of Medi-Cal or Part D extra help, then that also qualifies you where you can change a plan once a quarter. If you're diagnosed with certain conditions, like there's chronic special needs plans, people with heart disease, lung disease, even mental disease. There's different plans that you could enroll in once a year with those chronic conditions. Then we have special enrollment periods due to natural disasters. We've had more of those the last few years with the fires, with flooding, with storms. It's been crazy couple years, as we all know. So those create special enrollment periods for people. All right, so now you got your Medicare in place. It's time to make a plan choice. And the reason why is because we don't think Medicare is enough coverage. For one, they only cover 5 months in the hospital. After that, you have no coverage. So to mitigate those costs, you want to purchase a plan. So you can do this option 1 or option 2. You cannot do both. So if you do a supplement, these are categories of products. This is not one plan and this is a second plan. These are categories. So there are plans within the supplements and there are plans within the Advantage plans. Okay. So the supplement, the most common one these days is Plan G. So there all kinds of different companies offer it. We make a suggestion based on our experience and rates and all that stuff, but Plan G is the most popular. Medicare designs all those plans. You might have heard of Plan F, Plan N. They're all the same with each company. They cannot change the medical portion. They can add extra benefits, but they can't change the base coverage. So they decide whether they want to, offer that plan or not. And then, of course, they set rates and whatnot. So the supplements original Medicare. So Medicare A and B would be paying your base coverage. They would be your primary coverage. The supplement would be your secondary. Then we have the Part D plan we have to add on because this covers the prescription drugs that you get at the pharmacy. Okay. Medicare and the supplement do not cover the drugs you get at the pharmacy. They do cover drugs that you get like infusion therapy wise, which would include, there's all kinds of autoimmune type of infusion therapies medicine that people take via infusion to combat that problem, that disease. Chemo is an example of Part B drug that's covered up here on the medical side. These are really expensive, and so they're covered well on a supplement. Then you have Medicare Advantage plan, okay? If you're on an Advantage plan, you're still enrolled in Medicare A and B, but Medicare is like put on the back burner. They're not paying your claims. They're sending money to the Advantage plan every month for you being enrolled in the plan, and the plan is basically taking over your care. So this is also known as Part C. Medicare loves to use two names for the same thing. So Part C, Medicare Advantage, exact same thing. So the Medicare Advantage plans, most of them include a drug plan, and so that satisfies the Part D. And then they also offer additional benefits. They throw on dental, vision, gym membership, hearing benefits sometimes, over-the-counter medicines. Some of the supplements are doing that too. So they're getting kind of equal with the extra benefits. So I don't see major differences there anymore. The difference really with an Advantage plan is that this is where your HMOs and PPOs are. So they're always network driven. So HMO, of course, you pick a primary care physician, and whatever network you're in, that circle of that network, you have to stay in that network. Okay. If you go outside of that network without a referral, you will not have coverage with except for urgent care and emergency coverage. You have urgent care and emergency anywhere in the country. Outside of the country, it depends on the plan. They have different limits of what they'll cover, for outside the country. Some don't cover outside the country at all. Most do. It's just they limit usually the amount they cover. Um, so with a PPO plan over here, the PPOs still are network driven, meaning there's networks. So you have an in-network benefit and out-of-network benefit that allows you to go out of the network. But of course, the coverage is not going to be as good as in-network. So it really depends on your network. So that's what we know all the networks that work with the different plans. So once I find out what network your doctors are in, I can make plan suggestions based on that. Now, a supplement, people ask, well, a lot of people say, I want a PPO supplement. Well, a supplement is even better than a PPO. I think it's nationwide. Medicare is your base coverage. Okay. So Medicare's a federal plan. It's in the whole country. So any doctor in the country that takes Medicare will take a supplement because Medicare, when they bill, they send it on to the supplement company afterwards. So it's not like the doctor has to be contracted with the supplement. They do have to be contracted with Medicare. So as long as they accept Medicare, then they should accept then they do take your supplement. They don't, yeah, there's never a question, do they take the supplement? It's more, do they take Medicare? And we find that pretty much most doctors, except maybe concierge doctors, take Medicare with a supplement. Kaiser's an exception because they're only an Advantage plan. They don't take Medicare. So there are some other big medical groups that maybe won't take a original Medicare with a supplement as a new client, a new patient of theirs. But if you're an existing patient, they'll take you. So again, it depends on your doctor, your medical group, and I can help with that. So let's talk about a little bit more about Medicare. So if you just have Medicare by itself, basically you're going to have a deductible when you go to the hospital. It's your inpatient side. There's a $1,600 deductible for the first 60 days. And every time you go in the hospital, if you go in and then you go home and then you come back and it's been more than 60 days, you have to pay this deductible again. Okay. That's per benefit period. You have this deductible. And then after the 60 days, you're going to pay $400 a day for days 61 through 90. And then they give you an additional 60 days. It's called your lifetime reserve days. And you pay $800 a day during that 60 days. This adds up to over like $40,000. This is why you want to add insurance on top of Medicare and mitigate all those costs. Skilled nursing, Medicare pays for the first 20 days. You get 100 days total. And then Medicare, that you're going to have a $200 copay per day for days 21 through 100. There is no out-of-pocket maximum with Medicare, so you're always having to pay these amounts unless you have other coverage. And then after 100 days, that's considered long-term care, so that is on you. And again, no out-of-pocket maximum. On the Part B side, you have to pay the Part B deductible. It's just usually in the beginning of the year, $226. Next year, it's going to be $240. After that, Medicare is going to pay 80%, and you have to pay 20% of the Medicare approved amounts. So plus excess charges. So what that means is like if you had outpatient surgery and it's $50,000, you're going to have to pay 20%, which is $10,000. And then if the doctor charges excess charges, let's say his bill is 10,000 of the 50,000, they could charge you excess charges, which is 15% of the Medicare approved amount. So if his bill is 10,000, that's what he's approved for, you could be billed another 15% of that, which is 1,500. So this, again, why we suggest getting coverage on top of this. So again, the difference between Medicare Supplement and Medicare Advantage, Medicare Supplement's typically going to have higher premiums, but then you're going to have lower out-of-pocket costs as you use the coverage. Think of it as pay now, whereas Medicare Advantage typically has lower premiums. Sometimes they're as low as zero. We have many actually zero plans, but then you're going to have deductibles, co-insurance, and co-payments as you go. And so that's a pay-as-you-go kind of plan. Medicare Supplement, you can go to any doctor that accepts Medicare. All hospitals accept Medicare. And well, that's not true because Kaiser doesn't. Only for an emergency. Every hospital has to treat you for emergency. Medicare Advantage, you have to stay in that network of doctors, hospitals, facilities, it's all about being in network. And Medicare Advantage plans all have drug coverage. Medicare Supplement, you have to add it. So there's an additional cost there. So basically, some people like to pay a higher amount and then just not have big bills, whereas other people, they just want it all wrapped up in one plan. They want to carry one ID card. They don't go to the doctor much. They just want the low premium, and they've got the money if they do use it. They don't really worry about it. So it's really personal preference. Your coverage is going to be good either way. Let's talk about the drug plan now. It works the same. It's set up, the structure of the plan is set up the same, whether it's in its own standalone drug plan or if it's built into the Medicare Advantage plan. It kind of operates like a separate policy in the Advantage plan. So first of all, there's a formulary, which is a list of covered drugs. Every plan has a formulary. And within that formulary, the drugs are put into these different tiers here, okay? So your cheapest drug is tier 1. Your most expensive is tier 5. So basically, each company can decide, do I want to put that drug in a tier 1 or tier 2, 3, 4, 5? But typically, you're going to see your least expensive, like I said, and as they get more expensive, they're going to go into tier 5. And then the tier 6 is specific generic drugs. It could be like diabetic drugs and hypertension drugs and stuff. And it's a low cost usually also. So, and then we have different, like they can apply these to each drug. So you could have a step therapy could be applied to your drug. Step therapy means that you have to try a lower cost drug before they're going to approve that drug. Now, if you've already gone through that, say on previous insurance, you just have to let them know that. They'll talk with your doctor and confirm that, and they won't make you do that again. And they'll approve that medication. There's a quantity limit, sometimes put on medications. That's usually for safety reasons. Prior authorization for different reasons. Sometimes maybe there's maybe that conflicts with a lot of medications, that particular drug, and they want to make sure you're not taking one of the drugs that it conflicts with, where it could, cause harm. Or sometimes it's, let's say you're taking a drug that you're taking it for medical reasons, but it's also a drug that's for hair growth. Well, they don't cover drugs for hair growth, but they're going to cover it for, if it's for heart disease or whatever, because some do multiple therapeutic reasons. So they just want to confirm that. Formulary exception, let's say you have to take a specific drug and it's just not one that's covered. You can request your drug to be covered, and the doctor will explain why maybe the other drugs in the formulary aren't working for you. So this is the drug, that you need to try, and then they usually approve it. Preferred pharmacies, we always recommend that you use a preferred pharmacy. There's standard and preferred. There's not always standard and preferred. Sometimes there's just all standard. But if there's preferred pharmacies, we recommend it. It's going to be cheaper cost sharing. Your copays here are going to be lower at a preferred pharmacy versus a standard. Then we have this insulin savings program that is started a couple years ago. It's really great. Insulins used to be very expensive, and now a lot of them are only $35. the deductible doesn't apply. It doesn't hit the coverage gap or the donut hole, which we're going to talk about in a minute. So it's really a great thing. So people are saving tons of money now, this program. So every plan premium can be different. This is where the plans get to decide what my premium is, what the deductible is, what drugs I'm going to carry. So it's, we use a pretty sophisticated software that helps us determine, so we don't have to manually check all these plans. There's so many plans out there. If you don't, remember we talked about late enrollment penalty. If you don't get your drug plan in time, you could get a 1% penalty of the national average premium, about 30 cents a month for every month you could have had it. I just wrote some people the other day that didn't have a drug plan. One was 10 years, one was like 18 years, and it was around a $70 and a $35 penalty. It's a lot. So definitely recommend, we always make sure people get a drug plan when you're going on Medicare. And then again, the drug cost depends on which formulary. Each plan can set their own copays for each drug. So, and that can change annually. This year, from 2023 to 2024, we are seeing major changes with the drug plans because the drug plans are actually getting better and covering more, but someone's got to, that cost is going to be shared with the consumers eventually. So we're seeing higher premiums and stuff like that. So let's talk about the different phases of the drug plan or stages. You have these think of it like four buckets, right? And so you kind of go through these if you're on expensive medications. If you're not going to get very far in here. So the deductible this year is $505. It's $545 for next year. First, if the plan even has one. If some plans don't have one, Medicare Advantage plans often don't have deductibles. So then once you meet that, then you go into the initial coverage where you're making a copay or coinsurance based on the drug tiers, as we talked about. Now, when the total cost of what you're paying plus the company, so if you're on a drug that's $500 a month, which is very common, there's a lot of, all those drugs you see on TV are all in the $500 to $1,000 range. Very expensive. So let's say your copay is $40. So you're paying $40, the company's paying $460. That $500 combined, when it reaches $4,660, that's for this year, you hit the coverage gap, known as the donut hole. For next year, it's $5,030. So when you reach it, you now hit the coverage gap. You pay 25% of all of your drugs. Okay, until you reach what's called the true out-of-pocket cost of $7,400. Next year, it's $8,000. Now, you're not out $7,400 and you're not out $4,660. For next year, I believe you're out about $1,275 or something like that in here. And when you get to this, what we're seeing is people are out of pocket maybe about $3,400 if they reach that 8,000 mark, and then they go hit catastrophic. This year, when you hit catastrophic, you pay this small amount or 5% coinsurance for the drug, whatever's greater. But next year, when you hit catastrophic, it's all zero. You pay nothing. And this is where I'm saying the coverage is getting better. However, someone's going to pay that cost, and it happens to be in the premiums or even the copays and coinsurance kind of over here is where we're seeing that cost now. So go up. So that's pretty much it. I know this is confusing when you look at it like this. Don't worry about it. When you're using the coverage, it all makes sense. And the company, each insurance company, at the end of every month that you fill a medication, they send you a statement and they show where you're at in the different stages, and then they also kind of give you a projection how it will look for the rest of the year. So just to recap, Medicare only requires that you have A and B and a drug plan. But remember, they don't cover everything, so we suggest that you get more coverage than that. So you either do Medicare with a drug plan and a supplement, or Medicare and you get an Advantage plan. Now, this is kind of sitting on the back burner over here. They're not really paying your claims. The Advantage plan company is, but you still have to have Medicare A and B. Okay. All right. So just to wrap up, so working with us as agents is no cost to you. Basically we have the knowledge of all of the benefits with the different plans, what networks, what insurance companies. We kind of help you fill in all those pieces of the puzzle. And we help simplify the process by doing your applications for you, following your applications with the company, making sure that you get approved, and then we notify you that you're all approved. And anytime in the future years, like that's why we're so busy right now, we're helping all our existing clients during open or annual enrollment period make any changes that because their drugs change through the years. Maybe they didn't take any, now they do. So we're here to help them figure out what is the best plan for them going forward. So that's it. Thank you so much for coming today, and we will take some questions now.